Rectus sheath. The sheath is formed by aponeurosis of the internal oblique, external oblique, and transfer abdominis, which invest the rectus abdominis. So the sheath itself formed by the aponeurosis of the internal oblique, external oblique, and transfer abdominis. What are the content of this sheath? The content include rectus abdominis and pyramidalis muscle, superior and inferior epigastric arteries, and thoracoabdominal nerve. It's known as thoracoabdominal nerve because it supplies the thorax and moves to supply the abdomen. So it's known as thoracoabdominal nerve, the thoracic spinal nerve from T7 to T12. The T12 itself known as subcostal nerve. Okay? The rectus sheath. The rectus sheath has anterior wall and posterior wall, but we describe it in different position. First, above the costal margin. Above the costal margin, as you see in this picture, it has only the rectus sheath here. It has only anterior wall. Here is the rectus sheath, has only anterior wall, which is formed by aponeurosis of external oblique muscle. The second level, between the costal margin and the level of anterior superior iliac spine. Here, the rectus sheath has anterior and posterior wall. The anterior wall formed by the aponeurosis of external oblique, as you see here, and the posterior wall formed by the aponeurosis of transfer abdominis. What about the internal oblique? The internal oblique, it is aponeurosis divided into anterior layer and posterior layer. So the anterior wall of the rectus sheath, the anterior wall formed by the aponeurosis of external oblique plus anterior lamina or anterior layer of aponeurosis of internal oblique. The posterior layer formed by aponeurosis of the transfer abdominis plus the posterior lamina or the posterior layer of aponeurosis of internal oblique. The third and last level we describe below the level of anterior superior iliac spine. Here has anterior and posterior wall. The anterior wall formed by the aponeurosis of internal oblique, external oblique, and transfer abdominis, the posterior layer related to fascia transversalis. I will repeat it again. The rectus sheath formed by the aponeurosis of the oblique muscle. It contains the rectus abdominis muscle and superior epigastric and inferior epigastric artery plus thoracic spinal nerve from T7 to T12. This sheath above the costal margin, the anterior wall just formed by the aponeurosis of external oblique. Between the costal margin and level of anterior superior iliac spine has anterior wall and posterior wall. Anterior wall by the aponeurosis of external oblique and anterior layer of internal oblique. The posterior wall formed by the transfer abdominis aponeurosis of transfer abdominis, the posterior layer of aponeurosis of internal oblique. Below the costal margin, the anterior wall formed by the aponeurosis of external, internal, and transfer abdominis. Okay? As you see, this is the level. We discuss the rectus sheath. We have inguinal canal. The inguinal canal is the oblique passage located in the lower part of anterolateral abdominal wall, opposite or parallel to medial half of inguinal ligament. So just above the medial half of the inguinal ligament, you can find oblique passage known as inguinal canal. The inguinal canal, like a pen, it has two openings, superficial and deep opening. The deep inguinal ring and superficial inguinal ring. The deep inguinal ring located in the fascia transversalis. Where in the fascia transversalis? At midpoint of inguinal ligament. So we can describe it on the patient or in the cadaver. Where does it located? At midpoint of inguinal ligaments. Where? In which layer? In the fascia transversalis. Regarding the superficial inguinal ring, located in the aponeurosis of the external oblique muscle. Where in the aponeurosis of the oblique muscle? Superiolateral to the pubic tubercle. So now we can draw the inguinal ligament on the patient. Here is the opening of the superficial inguinal ring. Okay? This is the superficial inguinal ring, where it located in the aponeurosis of external oblique muscle. The inguinal canal has anterior wall, posterior wall, roof, and floor. The anterior wall formed by the aponeurosis of external oblique. Opposite the opening, the superficial inguinal ring is reinforced by conjoined ligaments. The posterior wall formed by the fascia transversalis. The anterior wall formed by the aponeurosis of the external oblique muscle. A lateral part reinforced by the muscle fiber of internal oblique and transfer abdominis, opposite the opening of the deep inguinal ring. The posterior wall formed by the fascia transversalis, opposite the opening of the superficial inguinal ring, is reinforced by conjoined tendon. The roof formed by conjoined tendon, the lower free margin of internal and transfer abdominis, the floor formed by inguinal ligaments. Okay? Here, the anterior wall formed by the aponeurosis of external oblique. Here is the anterior wall. Just a minute, I will describe something for you. This is the aponeurosis of the external oblique, which forms the anterior wall. Here, in the fascia transversalis, there is a defect here. This area of defect here, opposite the deep inguinal ring, reinforced by the origin of internal oblique muscle. The deep inguinal ring located in the fascia transversalis here, the deep inguinal ring. Okay. Content of the inguinal ligament or inguinal canal differ in male and female. In the male, it contains the spermatic cord, while in female, it contains the round ligament of uterus. In both gender, it contains ilioinguinal nerve. Okay? Regarding the nerve of anterolateral abdominal wall, we have thoracoabdominal nerve. We mentioned that thoracoabdominal nerve, it is known as thoracoabdominal because it supplies the thorax and abdomen, which is thoracic spinal nerve from T7 to T11, which supplies the muscle of anterolateral abdominal wall. Also, it supplies the skin of anterolateral abdominal wall. How it supplies the skin? It gives rise to the anterior and lateral cutaneous branch. As you see here, thoracoabdominal nerve from T7 to T11, it gives the anterior, here the anterior and lateral branch. Supply the skin. Also, it supplies the muscles. Also, the subcostal nerve supplies the skin of anterolateral abdominal wall, T12. The L1, the first lumbar spinal nerve, has two branches, iliohypogastric and ilioinguinal, which supplies the lower part of the abdomen. Okay? So, thoracoabdominal nerve supplies the skin. We already mentioned the nerve supply. Let here describe just the sensory innervation. The thoracoabdominal nerve and subcostal nerve supplies the skin of anterolateral abdominal wall. The L1, which give rise to iliohypogastric and ilioinguinal nerve. Iliohypogastric supplies the skin over the iliac crest, inguinal region, hypogastric region. Ilioinguinal nerve supplies the skin of lower part of inguinal region, mons pubis. In the male, supplies the skin of the scrotum. In female, labia majora. Okay? Blood supply of anterolateral abdominal wall. The anterolateral abdominal wall is supplied by superior epigastric artery, which is one of the content of the rectus sheath. The superior epigastric artery is a branch from internal thoracic artery or internal mammillary artery. Inferior hypogastric and deep circumflex, which branch from the external iliac artery. Let's describe one by one. The content here regarding the skin, the muscles and skin of anterolateral abdominal wall supplied by superior epigastric artery, which branch from internal. Also, musculophrenic artery. The musculophrenic artery and superior epigastric artery are branched from internal thoracic artery. The external iliac artery give rise to deep circumflex iliac artery and inferior epigastric artery. Okay? So, superior epigastric artery, inferior epigastric artery, deep circumflexed iliac artery, and musculophrenic artery. Okay, these are 4 arteries. Other arteries include superior circumflexed, superficial epigastric, which are branches from the femoral artery. I will repeat it again. Superior epigastric, musculophrenic, branch from the internal thoracic. External iliac give rise to inferior epigastric and deep circumflexed. Femoral artery give rise to superficial epigastric and superficial circumflexed. Also, okay? Lymphatic drain. Regarding the superficial vein and lymph node, the superficial lymph vessels superior to the umbilicus drain to axillary lymph node. This is the lymph node. The vein drain into axillary vein. The lymph below the umbilicus drain into superficial inguinal lymph node. The vein drain into great saphenous vein. Okay. The vein here above the level of umbilicus drain into axillary vein. The vein below the umbilicus drain into femoral vein. Okay, femoral vein. The lymph above the superficial lymph above the level of umbilicus drain into axillary lymph node. Below the umbilicus drain into superficial inguinal lymph node. What is the caput medusa? Caput medusa, it is the dilatation of the superficial vein of anterior abdominal wall. The vein around the umbilicus become dilated and tortuous. And this is known as caput medusa. Caput medusa may due to portal vein obstruction or portal hypertension or liver cirrhosis. Okay, that is all about anterior abdominal wall.